Every day, millions of people around the world use artificial intelligence to ask health questions. They ask about symptoms they are feeling, medications they are taking, lab results they don't understand, and diagnoses that worry them. Many people do this late at night. Many people do this because appointments are hard to get. Many people do this because they feel rushed during visits or because they simply want to understand what is happening in their body before they see a doctor. Using AI for health questions is already happening whether doctors like it or not. The real issue is not whether people should use AI. The real issue is whether people are using AI safely or unsafely. Some AI tools explain things calmly and carefully. Some AI tools sound confident and reassuring, but confidence does not equal safety in medicine. This video is not about replacing your doctor. This video is about helping you understand how different AI tools behave when you ask health questions, so you don't get misled, falsely reassured, or delayed in getting care. Today, we are comparing two popular AI systems, ChatGPT and Gemini, specifically from the perspective of patients asking medical questions. I am a physician and I want to be very clear from the beginning. AI cannot diagnose you. AI cannot examine you. AI does not know your full medical history unless you tell it. AI does not see your vital signs. AI does not take responsibility for outcomes. That responsibility always belongs to you and your healthcare provider. However, AI can be used as an educational tool. It can help you understand medical terms. It can help you prepare questions. It can help you recognize when symptoms might be serious. The problem is that not all AI systems do these things in the same way. Health information is not like other information. A wrong weather forecast might annoy you. A wrong restaurant recommendation might waste your evening. A wrong health suggestion can delay care, increase anxiety, or cause harm. This is why medical advice is careful, cautious, and full of disclaimers. When you ask an AI a health question, you are often doing so because something worries you. Maybe you feel pain, maybe you feel tired, maybe you saw an abnormal lab result. In those moments, reassurance feels good, but false reassurance is dangerous. Good medical explanations do several things at once. They explain possibilities, they recognize uncertainty, they ask follow-up questions, and most importantly, they tell you when something should not be ignored. This is where different AI models behave differently. Some models prioritize speed and clarity, others prioritize reasoning and questioning. In medicine, slowing down is often safer than speeding up. ChatGPT is designed to reason step by step. When you ask a question, it often tries to understand context. It asks clarifying questions. It explains why something might matter. It tends to emphasize uncertainty and encourage follow-up with a healthcare professional. Gemini is designed to retrieve and summarize information quickly. It explains things clearly and efficiently. It often sounds confident and well-structured. This can be helpful for general knowledge, but in medicine, confidence without context can be misleading. Neither approach is inherently bad, but they serve different purposes. If you are looking up a definition, speed is helpful. If you are evaluating symptoms, caution matters more than speed. Let's talk about symptoms because this is the most common way patients use AI. Imagine typing chest tightness, shortness of breath, or fatigue into an AI system. These symptoms can be caused by many things: anxiety, muscle strain, acid reflux, lung problems, heart problems. Some causes are harmless, some are life-threatening. ChatGPT typically responds by slowing down. It asks when the symptom started. It asks how severe it is. It asks what makes it better or worse. It asks about age, medical history, and risk factors. It often explains that while some causes are benign, others require urgent evaluation. Gemini often explains common causes in a clear educational tone. The information may be correct, but the emotional signal can feel reassuring. The danger is that early serious symptoms often do not feel dramatic. As a patient, you should never use AI reassurance as a reason to delay care. If symptoms are new, severe, worsening, or concerning, seek medical attention regardless of what an AI says. Many patients use AI to understand lab results. A1C, cholesterol, kidney function, thyroid tests. These numbers can be confusing and frightening when you don't know what they mean. ChatGPT often explains what the test measures, why it matters, what is considered normal or abnormal, and what factors influence it. It usually connects results to lifestyle, medications, and follow-up steps. It tends to speak in plain language. Gemini explains lab results accurately, often referencing thresholds and definitions. The information is useful, but sometimes feels more technical. For patients, emotional understanding is just as important as factual accuracy. Understanding your labs should make you feel informed, not overwhelmed. Here are rules every patient should follow when using AI for health questions. Never use AI to diagnose yourself. Never ignore symptoms because an AI reassured you. Never delay emergency care because an AI suggested waiting. Never change medications without consulting a clinician. Use AI to learn terminology. Use AI to prepare questions. Use AI to understand why your doctor is recommending tests. AI should support your healthcare, not replace it. So, which AI is safer for patients? For symptom clarification, education, and health questions, ChatGPT is generally safer because it asks questions, flags risk, and emphasizes uncertainty. Gemini is useful for general information, but caution is essential when symptoms are involved. AI is a powerful tool. Used wisely, it can help patients feel more informed and prepared. Used carelessly, it can mislead and delay care. My goal with this channel is to help you use AI safely, responsibly, and intelligently. I'm Dr. Saab. This is my AI doctor. Subscribe for calm, evidence-based guidance on health and artificial intelligence.